The Spirit of Women webinar series is a new benefit of your Spirit membership designed to inspire, inform, and help our hospital affiliates stay on the cutting edge of innovation in healthcare marketing while maximizing their exclusive-to-market benefits of Spirit of Women. Join Tanya Abreu, President of Spirit Hospital Networks and Chief Visionary Officer for Spirit Health Group, for a lighthearted but heavy-hitting discussion of industry trends and key practice points for the successful promotion of healthcare to women using your Spirit of Women program and the help of your dedicated hospital strategist.
Hello, Spirit of Women affiliate hospitals. This is Tanya Abreu, and thank you so much for joining the call today. I know in today's healthcare reform environment, every moment is like the ticking of a clock, and work days are just so jam-packed. So to know two things: one, that you embrace Spirit as a way to be efficient and really get the work done in your communities is wonderful. And two, I just am so happy that you're able to spend a few moments with myself, Tanya Abreu, and I'm the president of Spirit of Women, but also the chief visionary officer of our larger Spirit Health Group, along with our key staff that many of you know, Mike Farinello, who's a hospital strategist, and Melissa Owens and Stacy Rickey. They're here today to reflect on some of their, and it's always the most recent, it's always the most top of mind kind of examples of the things that we talk about internally. And hey, members, we talk about you every single day, and it's 99.9% positive. We are learning, and we are in the middle of being the kind of the repository of all of the successes that you're making, and hopefully we're able to divert some of the challenges away from you. So I'd like to start today with this little formula that we've been kicking around the office, and we hope it makes sense to you. Many of our hospitals tell Paula, and everyone knows Paula Commerce, and she's our national executive director of the network, our kind of head of ideas and how to make Spirit work and stick and function. But, you know, we thought, you know, some hospitals will say, is there a cheat sheet? Is there a cheat sheet? And so I wanted today to kind of put together, really, I travel the country. I get to meet with hospitals who are not members, hospitals who are, speak at conferences, talk to women. And I've been looking at this formula. And people, I will ask, CEO, what makes Spirit work? And it's usually men who kind of flip and say, oh, it's magic. I don't really bother. I just look at the money. And I kept thinking about that word magic, Spirit magic, and, you know, and I thought we'd play with that. So today I'd like to focus on the magic of healthcare marketing and converting consumer experience to hospital business, because that's what it's all about. When push comes to shove and you've got to renew Spirit and you want to be proud of Spirit, it's about how many of those great, fun consumer experiences converted to real business for your hospital. Magic, as you may or may not know, is the art of producing illusions as entertainment. And I love that, you know. I think every word we ever say is an illusion, but it's entertaining when it's called magic. And I kind of broke down healthcare marketing in a fun way, too. It's the art of producing hospital business through consumer experience. The art, and it is an art to produce business. It's not just to go out there on a rainy day and sell ponchos. It's complicated products we have, and so we're trying to do this through really kind of remarkable consumer experiences. You know, Zig Ziglar, one of the great gurus of marketing and promotion and salesmanship, just recently died, so his quotes are everywhere, but I found this one the other day, and you know, you would think that what doesn't hold true in hospitals and how we choose doctors, but it is. People don't buy for logical reasons, they buy for emotional reasons. People don't choose a doctor for logical reasons. They choose them for emotional reasons. Likewise with hospitals, especially in healthcare. Our patients choose our hospitals and our doctors as if their lives depended on it, and they do. So it's a very powerful seat that we sit in today when we promote health to our communities. You know, marketing really transforms reality into what you want it to be, right? It transforms reality in your favor if you're a successful marketer. Personally, right, if you want to get something from your spouse or your kids, you market a certain way. When they say yes to what you want, you celebrate. Likewise in healthcare. There's some realities, though, right now with healthcare reform and other influences that I just want to draw out in this conversation today. The first, and this is the one that you should really bring home because it's probably the reason why you are enrolled in Spirit membership. The reality, consumers are not having fun with hospitals or healthcare providers. They don't trust advertising, and they simply don't have time to mess with the lecture series. And you know, we're talking to more and more consumers. Some of them just don't have time to even, you know, surf the web anymore. So they're not having fun. And, you know, everywhere in the media is things about healthcare reform and how much money they have to now spend, and if they don't have healthcare insurance, they're going to go to jail. And, I mean, really, the rumors that are out there are crazy. So healthcare is not fun. Reality, most hospital executives, staff, and healthcare providers are also not having fun in their careers right now. Healthcare reform, market threats, confusion, and the drive for change is taxing our emotional health as leaders. And I don't think that needs much explication. The other reality is that the hospital market competition is loud. Fueled by all this accountable care moves that are happening in our community, integration, physician employment, and population management goals. Every hospital and healthcare system is jumping and chomping to prove their value to the community. And that is, I think, really important for us to know that who our competitor is today might not be our competitor tomorrow. They may be our partner. And so the markets are loud. Everyone's just trying to get out there and be preeminent and be the favored partner. Lastly, and this to me today anyhow is the most important, you are a Spirit of Women member hospital, and you really do have all the tools. You have all the magic you need to transform the current market situation to your favor. You might just need a little fine-tuning, a little magic formula. We're going to go through the magic formula today far too quickly, but that's one of the benefits of membership. You have me, and if your analyst needs to schedule a call between the 3 of us or the 5 of us or the 20 at your institution, we can do this. We can get through things very, very quickly here today and really iron out some details later. So let's start with M. M, quite simple, make a promise. You know, one of the most important things to remember is a promise is not your mission. I did a review. I was lucky enough to have a really outstanding fellow last year who has now become a full-time employee under Paula, but she did an incredible amount of work for us on hospital mission, and there was about 10 standard missions. It was basically, you know, we take care of the community, we do it with love and compassion, and I'm not making fun, but it was pretty much all hospitals share the same mission. Promises are very different. A promise can be operationalized in actions and measured by the numbers of people who remember your promise and how many times you demonstrate it. A promise brings something specific and needed to someone's life. I promise to make sure you are screened for breast cancer every single year. I promise to make sure that everyone in your family has diagnostic testing when they need it. Very different than your hospital mission. So begin to think about that. A promise should be made carefully and kept faithfully. Of course, this is my personal aside, but very true, you know. Broken promises, and we do it all the time personally, and we do it even more professionally, need to be addressed. How many of you promise that every patient gets the best nursing care, and then they don't? You need to apologize. You broke your promise to a patient. And then you have to build your trust up over and over and over again. And here is the key for you to take back to your C-suite as well. A promise is at the core of the most successful business enterprises in America. Forbes magazine did an incredible study, and you can look it up online and look at it a bit. But every fast-growing, long-lasting corporation in the United States has made a promise instead of a mission. Things like Southwest, they promise that you are going to have more fun on their airlines than any other. And everyone lives and breathes and measures that promise. You look at Nike, everything they do, every ad, every piece of clothing, every sneaker, everything is just do it. Take an action. Stop sitting. Don't worry about what the ad says. Keep it minimal. Just do it. Target is all about family value. You walk in, you see the big red board, you're amazed at how much they give to the community. You walk around, you see that it's kind of just nice, and everything is about family, and they arrange it so the children are in the middle, the stuff for children. Right? You know, they really are thoughtful about how they market and how they keep focused on their promise to make American communities better. And then lastly, I have up here is Apple, innovation. You know, people who are Apple loyalists, and I won't name anybody in the room, that might include me, are tenacious in defense of the Apple, and certainly because you don't expect anything but the best in innovation from them. When I do private consulting with hospitals, I say, how can you be the darn Apple of this community? How can you make a promise to be better? What specifically are you going to do? So when you go back, one of the things I always do with this magic formula is go sit with the people who make decisions. Ask them if the hospital has a promise and how is it being operationalized. I've asked Mike to spend a few minutes talking about, and we have lots of promises in action of our hospitals, but I asked Mike, you know, to go through his hospitals and to share some thoughts. Mike, can you do that for us?
Sure, Tanya, thank you. Basically, Indiana Regional has not necessarily made a promise, but has drummed up an initiative to get members of the community to make a promise. Since 2011, they've encouraged women to take the Pink Pledge Promise, and basically those taking the pledge promise to get their mammograms and annual clinical breast exams from a doctor while also encouraging friends and family to do the same. This is really just a way for them to reach out in the community and touch as many women as possible and get them to take action for their health and their promise.
Now, have they noticed that? Now, and I will tell you, because I have heard them speak at breast cancer conferences, they do have a promise that when you go into their breast center, it says, we promise to take you through this with as least fear and knowing as soon as possible. There's, I don't know the exact words, but it's there. But Mike, have you talked to the clients about the differentiation? I know we worked with them on promise. This Pink Pledge campaign is not a spirit program, but it is a spirit-inspired concept. What happened to their breast center in terms of growth or things like that?
Well, you know, it's more than just having the community make a promise. They also have a women's health navigator at the Women's Center who's kind of helping these women follow through on their promise, make sure they're getting the support they need.
So it's a promise keeper. I love that. Instead of a health coach or a health navigator, here's someone who's going to help you keep your promise to yourself. I know one of the diet, I know that some of them have coaches like that. What's your promise to yourself? And I'm going to help you keep your promise. So very nice. Thank you very much.
Thank you.
Okay, we're going to move on because we're on time here. A is for accountable, and you know that word used to give me stomach cramps in my life, you know. But it's be accountable, and accountable is really numbers. And accountable is performance. And look, if you believe with all of your heart what you're doing is right for the business and right for the health of your community, you can account for it. So be accountable for the performance of your promise. You know, you have to be accountable for the actions that need to be set up. You have to know what actions you're going to measure from the very beginning of whatever promise or project you're doing. Be accountable to quantify your success and outcomes and stick to your plan as much as you can. If you have to change it, that's fine, but measure your changes and the differences they made. Accountable to track downstream revenues as a result of your promise and your actions. Be accountable to tell the human story beyond the numbers. I'm finding more and more of our hospitals, as all of you know, we just launched Spirit Business Analytics last year, and hospitals have now, I go to see their CEO and the directors or the vice presidents, all they do is give me their numbers. And I'll say, what happened to the Spirit story? And I'll say, oh, yeah, well, that's great, but the numbers, they need to be together. So when you get those numbers, that's your foundation. But you ain't got walls unless you have a story. So your numbers are your foundation, your stories, your building. And then promote the results to everyone, you know, and that's important. But here's what people miss in accountability, all right? They miss this fact. Wait and make the person that you were just accountable to let you know what you just said. Make sure they hear your numbers. Make sure they hear your impact, or else it will go in one ear and out the other as fast as the soft marketing that you did. So promote everywhere and wait and listen to hear back is always the great advice. Now, I'm very, very excited to talk about St. Francis. St. Francis is a relatively new member. Melissa Owens is their analyst, bar none. She's done a great job. They have decided, their competitors right across the street, they now want to be innovative care with spirit, a soul. They went and said, look, we're early in the game, but we want Spirit Business Analytics from the get-go. So, Melissa, phone's all yours.
Yes, St. Francis has really, from the get-go, has a very well-laid plan. Before they partnered with Spirit, they knew that they had some fragmented marketing for their women's service line, and they saw a need to provide an umbrella strategy for it, and so Spirit fit the bill. So the Spirit business plan was written with that in mind. And Erin Myrick, their coordinator, she just follows that plan to a T, and that is a large part of their success.
Like a formula. I can't stress that enough. Find the formula that works.
Absolutely. And so basically we were able to do their Spirit Business Analytics within 5 months of their programming. And already within 5 months, they're higher than the first-year average of Spirit Women Hospitals.
Oh.
So that is huge. That is huge.
That is exciting.
And obviously making difference.
And they're measuring money, measuring consumers. What are their metrics?
They're measuring, money, but they're measuring too. They do surveys to their consumer memberships, and they're getting great, wonderful feedback of what a great time they're having at these events, as well as the education. They're getting great feedback from physicians, which was also part of their plan, was to engage physicians.
And I think that's great because really the subtitle for this little talk we're having is convert the experience, whether it's the pledge, the promise, or the Spirit experience to real business. And the idea that they have a navigator that keeps promises at Indiana Regional, or here they have real numbers around each experience. It's very exciting. Now, remember, those of you who are on the phone, just take a little note, call the analyst. They will share this data. You can talk to the hospitals. You can visit the hospitals. I know everybody wants to go to Topeka, Kansas, or Indiana, Pennsylvania. But actually, they're not bad in the summer, both of those places. But I think that, it's really exciting to hear how advanced and sophisticated our hospitals are getting with that experience. So thank you. All right, let's move into the G. I'm going to be very quick about this, and it's really right in the middle of magic, and it might be the most important dimension to your success right now, and that is grow. Grow personally as you grow business. When I work with myself every year, and, I might be a boss, but I ask myself, what did I grow as a person? I don't care about how much money I made or what did I do. Well, how did I grow as a person in the job that I do? And if I'm not happy about my job, I'm not going to set higher standards. When we promote, and especially in marketing, we have to grow with it. We have to feel that it is growing us as much as we are growing the business of the company and the cause that we work for. And also, simultaneously, help your colleagues and staff around you find inspiration in Spirit. Spirit of Women can be, a program that is done internally in your marketing office before it goes out there. See if it inspires. If it doesn't, let us know. And if it doesn't, work it so that it does. Health is related to growth and learning. We know that. The more adventures you have, the more you feel you learn, the healthier you are. If you can turn that experience into a patient, you will have that patient for life. Ask your patients, ask your community, how is your spirit being enriched? To be a hospital that not only treats a woman's body but enriches her spirit is to be the hospital of choice. So think about growth. The next letter is I, and I love I. It's isolation. Isolation is what kills old people when they stop having contacts, when they stop networking, all kinds of stuff, including readmissions to hospitals happen. But truly, isolation helps us market better and helps us convert consumers to business. We need to prevent isolation of the people around us, including our staff. But isolation disappears when you start building communities. And that's what Spirit's primary goal was, to build communities, to build your advisory board, to have event planning groups, get excited about your hospital and what experiences it's bringing. The Day of Dance, the Spirit Girls Night Out, membership clubs that about 80% of our hospitals are doing, the social networking that's starting to happen on Facebook as more and more hospitals are becoming Spirit Facebook presences. Remember, isolation causes hibernation, and people buy in crowds. Let me ask you this. Do you think of your hospital events, those things that you spend so much money and time on, do you feel like they're Macy's coupon days? And if you don't, you have to. When you go to Macy's, you have to buy something with that coupon. You're out there with thousands of other people. You get up early to do it. Hospitals can generate that kind of excited consumer. We really can. And we know that. And Stacy Ricky, who's been with us 5+ years as an analyst and has just so much experience in this event we're going to talk about briefly, which is our biggest event. I just got off the phone with St. Luke's in St. Louis. They had to close Day of Dance registration at 1,700 people. Cross-generation, mothers, daughters, kids, husbands, grandparents. Really exciting. It's our biggest non-isolating event. But how does it convert to business, Stacy?
And thank you, Tanya. As you mentioned, just with growth and like St. Luke's closing down their, having to close off their event, an event such as Day of Dance, it just fosters and builds community growth and engagement. And as you know, Day of Dance is to help eradicate heart disease and raise awareness of cardiovascular disease. And through Day of Dance, you're able to do that by raising awareness of not just health education, but incorporating and inserting a little fun by dancing into many of these events. And you've seen all the successful fun dances that are pretty topical these days, like your Zumba, line dancing, those sort of things. So it's that fun engagement, those little fun things that you can have out in your community that will draw them to your event, and then you're able to slip in some health education, particularly around cardiovascular disease. We hear from a lot of our hospitals that, not only obesity and things like that, but also cardiovascular disease is very important to raise awareness of.
And there's real conversion numbers, and I know that most of you have seen the reports that we do each year of how many, it's up 40 to 50% of attendees then attend a primary care, make an appointment with a primary care doctor, and upwards of 20% of people have risk factors that need to be treated. So this is community service, talk about community service, but it's also more importantly directly trackable and measurable. Thanks, Stacy, very much. We're going to move on, and here's some of the Day of Dance, and you can see every single year we work at making it non-isolating. This year, with all those pictures joined in one heart, it's the ultimate it's the ultimate isolation being eradicated. C, honor the courage in your community. We forget in healthcare to do this, and we especially as healthcare has become more and more of a business and a challenge business. Honor the courage in your patients, in your staff, and in yourself. And this is a mushy part, but it is, when I go into a hospital and I meet a CEO that says, I had the courage to bring spirit in here. Thank you for coming today. I want to tell you what it's done. I know he really means that. And whether it was spirit or something else, this person, male, female, had vision and bravado to change the way women were talked to in the community. Courage events like SGNO, honor people. Honor people for their bravery, for their bravado. And it's not always just facing cancer. Women love to sit through people who just triumphed over, going broke and coming out of it ahead. Or, domestic violence. Or something even less than that, not less than that, that's not. But something even more everyday than that. Like, I had a bad spending habit on weekends. Or, oh my gosh, weight loss. I had the courage to admit that I was too heavy and I had to do something about it. Women love this, and they will love a hospital that focuses on this. Whoops. Promotional events, we have, and I know that probably 80% of you on the phone do not know about our free program that's out there called Hand in Hand, but it encourages in a brave way husbands and wives to join hands and come into the hospital and have their cancer screenings together. If you don't know about it, call your analyst. If you don't know who your analyst is, shame on you, call me. But I will get it into your hands because it's a very cool program. Day of Dance is a stage for courageous doctors and their heart patients. I went to an event and I cried my eyes out. It was in New York. They brought a patient out and they said, this woman is only 38 years old. She dropped in the grocery store. She would have died, blah, blah, blah. Then they brought her doctor out, they put a spotlight on them, and they waltzed, and it was the most beautiful thing I'd ever seen. And I know that if I were in that community, that would have right there, talk about brand loyalty, talk about a moment of true vision of the courage of that doctor and patient working together. Showcase your staff, showcase your doctors. How are your staff strong? How are your staff resilient? So many of you have been bombarded, unfortunately and sadly, and you have our love in our hearts here from South Florida with tornadoes and devastation. How are people dealing? How are they being resilient? How is it affecting their health, and how are they giving back? Sponsor community and organizations and events that honor indomitable spirit. Go out there and get that fire station. You know, go out and really show what you value. Rewrite your hospital's story. That's what I hope Spirit does. When a hospital has spirit, they also have courage, survival, fortitude, championship for women. Tell the Spirit story through your own voice as a hospital, not through our voice. How has Spirit allowed you to focus on really what drives your community and what drives the best and strongest things in your community? And this is, I always have to do a little personal aside when I work with myself and professionals. Go to your own bio. Go to your professional life story and have a glass of wine or a glass of juice and rewrite it. Note your fearlessness. Honor your ability to survive through various things, both professionally and personally. When you do that, note how you feel. And think about if you had a doctor or a hospital that encouraged your pride in your own strength and resilience, whether you were sick or not. And it would certainly be the hospital you chose for yourself and your family. Make a promise. Account, grow, isolation avoided, courage always honored. Thank yous, gratitude. But I really suggest if, even when you do your strategic site visits, guys, in the room, and anybody's been through this magic, it's kind of fun. It's a real quick way on site to say, what are you doing for MAGINC? Those of you that are on the phone and you have questions or want to talk further or want to do your own magic formula with your analyst. Uh-oh, I gave you guys more work. Call in your analyst and say, I want to go over my Spirit magic. What's there? What's missing? What can we use to make it better? And please send your questions, and we're happy to get back to you very, very quickly. Thank you.